Hello everyone, I'm really very excited to welcome you to today's edition of Talking Health with Dr. Laz, your most insightful, educative and informative program on television. We are reaching you on your television channel of choice, the Africa Independent Television, AIT. My name is Dr. Laz Eze. The COVID-19 pandemic has adversely affected our health system, and our health system before now has been very weak and with a whole lot of challenges. And it has further stretched with a lot of reports of lack of access to health care, especially to people who are having non-COVID situations. While much efforts are being made to contain COVID-19 pandemic, other health conditions are not reducing in terms of incidence or the prevalence in our country. A lot of medical and surgical emergencies are being affected and they require emergency treatment, but not so much is being done in some parts of the country. According to the World Health Organization, 1.35 million people die every year as a result of road traffic injuries and crashes. And 93% of this number occur in low and middle income countries, including Nigeria. On the program today, we shall be talking on the management of surgical emergencies amid the COVID-19 pandemic. And of course, the special focus will be on the Federal Capital Territory and with insight on what's happening in the entire country. There are three fundamental functions of a health system, as you can see on the screen. Number one is to prove the health of the population. The second is to respond and meet people's expectations. Number three is to provide financial protection against the cost of ill health. Effective management of medical and surgical care contributes significantly to achieving all these key functions of a health system, of a local government, states, or even a large country like Nigeria. In 2017, there was an observational study conducted at the Maitama District Hospital here in Abuja, and it found that 43% of cases seen in a 2-week period were road traffic injuries. Specifically, a total number of 1,386 cases were seen. And this study also found out that Maitama District Hospital, where that was studied, had most of its ambulances grounded. How can we improve the quality of health and access to emergency medical services and, in fact, the Nigerian healthcare system in general? Right after the break, I'll be talking about these issues with two consultant surgeons. Dr. Adeoye Adetiloye will join me here in the studio, and we'll have through Skype Professor Chinda, and they are going to be talking about issues around emergency management medical services, especially during the COVID-19 pandemic. Please feel free to follow us on our social media handles displayed on your screen and share your views and opinions during and after this program. I'll see you after this short break. Do stay with us. Welcome back to Talking Health with Dr. Laz, your favorite health program on television. My guests on the show today are Dr. Adeoye Adetiloye. He's a consultant orthopedics and trauma surgeon and also at the Gwarinpa General Hospital, and he's also the coordinator of emergency medical services in the Federal Capital Territory. Dr. Adeoye, welcome to the show.
It's my pleasure, Dr. Laz.
Also joining us on Skype here in Abuja is Professor Chinda John. Professor Chinda is the head of Department of Surgery at the University of Abuja Teaching Hospital, and is also a pediatric surgeon. We are glad to have you, Professor Chinda. Coming to you, Dr. Adetiloye, COVID-19 has presented a lot of challenges in our healthcare system, and there's been rising reports of cancellation of surgical procedures, rejection of patients in different hospitals. But before we get to how COVID-19 has affected medical care in the Federal Capital Territory and in Nigeria as a whole, I would like you to speak to us briefly on some of the common surgical emergencies that we have in Nigeria that you encounter in the course of your practice.
Okay, thank you very much for bringing me on the program. So the common surgical emergencies that we encounter usually in this period range from simple things such as dog bites,
Okay, dog
following
bites.
domestic accidents, arguments and all. Then you also have things like burns, electric burns, hot water burns, we still have those. And sometimes, rarely, we have some flame burns that still happen. Then the common emergencies that follows trauma, we still have them. We have patients who still come with head injuries, patients who still come with musculoskeletal injuries, long bone fractures. We have patients who still have blunt chest injuries. Some other patients also come with blunt abdominal injury where they may have damaged internal organs. So these are still very common emergencies. Also, the very common appendicitis also still present in an emergency form, and they still come. It's just that with this COVID-19, the approach to care has changed a bit, yes.
That's expected. What about snake bite?
Yes, we still do have snake bites,
Are there seasons that is more common?
Of course, the snake bites are much more commoner, about this time, yes. And throughout the year, you have snake bites. It's just that maybe about this time because of the rain and all that, when they have a little sun, then they want to come out. So we still have snake bites.
They feel the cold too.
Yes. Then we also still have scorpion bites as well. Scorpion bites, so these are things we also need to take note of.
Okay, that's fine. Each of these is a full program on its own. It's a full topic on its own. But it's important for people to know that dog bites, is one of the common things that we have to contend with.
Snake bites, human bites also from fights.
Interesting.
Yes, physical assault and all.
Okay, in Federal Capital Territory, you are the coordinator of the Emergency Medical Services.
Yes.
So what's the situation of things, especially we know that we don't have the best of emergency care in the country generally. So, but what's the situation in Federal Capital Territory, Abuja?
The situation has actually improved compared to what we used to hear of many years back, because we now have improved response to emergency care within the Federal Capital Territory.
Yeah, it would be nice if you speak to the specifics on the improvements from 5 ambulances to 200 and those kind of things.
Okay. About some years back, most of our ambulances, particularly in the government hospitals, were down. But very recently, I took a little census of some of the ambulances we have. We, at the Emergency Medical Services, for instance, we have very, very active 3 ambulances that are functional. And in all the FCT hospitals, they have an average of about 2 ambulances. So at least 1 is functional and well equipped.
Okay.
And apart, that is even for when they need to evacuate patients or take patients from another place to another. We also need to also know that our emergencies, in the hospitals, at the care centers themselves have also improved. They are adequately manned, so we have the adequate manpower, and then we have the things to work with. Most of our government hospitals are not like the usual general hospitals that are, usually not well equipped in other parts of the country. But here at the Federal Capital, the government has actually equipped a number of our hospitals to cater for this emergency.
Okay, the improvement you talked about, is it from 2020 or like 2017, or can you give us a picture? Because there was a study in 2017 that looked at emergency management of, emergency management in Maitama District Hospital. And a key finding was that most of their ambulances were grounded. And also in 2019, I knew someone whose wife was to deliver a preterm. They had an emergency, so and they required incubators. So they needed to move from one hospital where they were to another, and there was no functional ambulance at Maitama General Hospital to move them. In the course of the movement, they lost the pregnancy. So, and there are so many cases like that. So at the moment you say that, okay, the EMS where you coordinate has like 3, and each of the hospitals have at least one functional, including Gwarinpa General Hospital.
Gwarinpa, we even have 2.
Okay, 2 functional ones. So what number would anybody in the FCT need to call if they need these ambulances?
Well, you know, the emergency medical services, we try to make it, you know, well integrated with the services provided by other, you know, ambulance service providers in the FCT. So, and the federal government also is collaborating with us. So we still make use of the National Emergency Management Agency, NEMA number, the number to call 112.
112.
You know, yes, that number is still very functional. Also, the 122, you know, but what is important is that when that is done, the primary responders, we usually respond and they bring them to the most, the nearest hospital where such care could be provided.
Okay, 112 or 122?
Yes.
Okay.
So, still on the numbers, there's actually an app for emergency response in the FCT, FCT Emergency Response app.
FCT Emergency Response mobile application.
Yes, so you can get it on the Google Play Store or the Apple Store. And once you have it installed, so not only medical emergencies, there are other emergencies, even for COVID-19 issues, which could be addressed. And we have specific numbers that will also be responding to such needs.
Okay, that sounds good. So those who don't have Android phone or internet-enabled phones, they can call
the 112
or 122. Yeah. Those who have internet-enabled phones can download the application, which they can use to make
They can use it, and they have various numbers to call for various things.
Okay, thank you, Dr. Adetiloye. Before we go, we need to look at some of the common fractures that you've had to do with. We have to treat, because it's good for our viewers to know that hospitals are competent in the management of fractures, because you know that it's very common for people to give excuses and go to traditional bone setters and seeking other alternatives when it comes to orthopedics care. So, but what has been your experience like? Have you had cases of patients that you are treating having to leave the hospital to go for treatment elsewhere, especially the traditional bone setters?
Yes, there's quite a number of patients who just prefer to be treated in the traditional bone setters place. You know, our people, they still have this belief system. You know, the traditional belief that bone is not being managed in the hospital, or the fear that their feet could be amputated. So the belief system is making some of them to want to go there. Likewise, some believe that these accidents are as a result of some cerebral attack. So the religious belief tends to want to influence some of them. Then some of them also, maybe because of the, you know, the sponsor for the treatment, he may actually prefer the to take the patient funding, yes, because they believe that could be cheaper. But in the government hospitals, the orthodox form of treating fractures is quite better, and it's very, very result-oriented. The patient cells will heal their fractures faster, the wounds are better managed, and ultimately it is cheaper for the patients, because after they've gone to those traditional bone setters, they spend longer time, and by the time they will now come back with complications after spending almost a year or over that period.
So we have Professor Chinda John on the Skype, joining us on the Skype. He's the head of department of Professor Chinda is a professor of pediatric surgery. Professor Chinda, welcome to Talking Health with Dr. Laz. Can you hear me, Professor Chinda? Hello, Professor Chinda. If you can hear me, just respond, sir. Thanks for staying with us. We are going to tell you more about a common type of fracture that many Nigerians get to experience, especially those who are very active in sports, ankle fracture. It can come by road traffic accidents. Some persons also sustain this fracture, like footballers, and so many other situations like twisting of the legs that could happen in a lot of sporting activities. So Dr. Adetiloye is a consultant orthopedic surgeon that will be speaking with us, and he will quickly, let us know how this is being fixed. Thank you, Dr. Adeoye, for staying with us. So can you speak to the image on the screen, sir?
Thank you very much, Dr. Laz. So as you could see, that this is a very severe injury to the ankle with a complete destruction of the ankle mortise. The configuration is completely shattered. Like you said, this commonly follows maybe road traffic accident or sporting injuries. But interestingly, this actually followed a fall. All right, so the ankle was completely disrupted, and the lower end of the tibia, as you can see, is completely displaced.
Okay, so where is the tibia?
Out. The tibia is that long bone.
Is the lower end of the tibia.
Yes.
So you could say this place is supposed to be joined here,
yes.
right?
Yes.
So the fracture has made this to be separated.
To completely be separated, to be off-ended. It's supposed to be lying on this talus, and it's completely separated.
The tibia, the fibula, the two bones that you have in the leg. So what about the other side?
This is the other view of this ankle injury. This part is supposed to be here. So it's completely disrupted. So these are not the type of fractures that you think would have a good outcome at the traditional bone setters. So, and not only does this patient have this fracture, you can imagine that the structure, the soft tissue on that medial side,
that's the skin, and the blood vessels,
the tendon, and the blood vessels. So that foot is endangered. So whoever makes that mistake of taking this to a traditional bone setter,
there could be infection, gangrene, and
in
other
fact,
things.
The list is endless. So these are some cases that don't have to wait. You have to treat them on an emergency basis. You have to bring back that bone, then begin to treat the soft tissue. You elevate the limb, you reconstruct the soft tissue, you wash and clean very well. So because of this COVID, most fractures that are not severe or not displaced, that are stable, are usually managed without surgery, conservatively. But in this period, you cannot keep this type of fracture. That person will certainly
must come to the hospital.
Must come to the hospital. It has to be operated upon. And these are the kind of fractures that, where you fix them very well, then the hope of the person walking on that foot is being restored.
That sounds good that there is hope, because I can see the extent of damage is something. Like what duration will it normally take after surgery on this kind of fracture? What duration could it take?
Usually lower limbs, once you fix it, we also give some external support. And once the soft tissue has healed very well, with the external support, within a couple of weeks, the patient could actually be on
with some support.
With just some support.
Not putting weight on the leg.
Absolutely. Even with some kind of walking cast, they could actually put some weight on it once the soft tissue wounds have healed.
Okay, so when we started, we talked about the ankle fracture.
Yes.
This is a fixed ankle fracture, right? So is it the...
It's actually that same patient that had that fracture in which the ankle was completely disrupted.
Wow.
So you can see here, the whole ankle has been reconstructed.
Okay.
So those bones that were disrupted has been rearranged, and we have fixed it with this plate and then multiple screws. And you can see...
So like in this case, this is
that's the tibia.
The tibia bone.
Yes.
This
and
is
that's
screw.
the malleolar screw, yes, on the medial malleolus.
Okay, yeah, the medial, the malleolus is that
the
small bone that comes, that's part of the ankle.
Yes.
So this is what?
That is the plate that is put, and on that lateral view, it appears ends on the fibula.
Okay, it's actually showing better.
It's showing better on this anterior-posterior view. So we can see the ankle mortise has already been reconstructed and the fractures rearranged, and you want to avoid putting some screws through the fracture so that the healing could easily heal. So then this patient has a hope of being able to walk back without much difficulty.
So is it the kind of thing those footballers that have severe ankle injury leading to structure, the kind of fixing, that's why they have to be on the bench for a very long time before they get back to play?
Absolutely.
Fantastic. Do you take out the screws and everything after the healing?
Sure.
Or it remains there?
If the patients wish, these are inert implants that could stay there forever.
Okay, they are not going to react with the skin or the soft tissues around it.
Yes, so, but if the patient wants it out, then when the fracture has consolidated very well, years later, then they come back there, we remove them.
Wow, that's really very good.
Okay, this is just another way.
A hip fracture.
A femoral fracture. This
Okay,
another
femoral fracture.
He had a malunion. You can see that was the malunion that we had to take down.
So what's this?
It's called an interlocking nail.
Interlocking nail. So this is the bone, the outer part. This is the point you have the fracture.
The fracture, yes.
So malunion is when
The
it
bone
doesn't
was
align.
lined.
You
Yes,
have
very
this
well.
bone, you have this, maybe you have something like this.
Exactly. So that bone was actually overlying here, and there was
Okay.
some shortening that was
Okay.
encountered with that, and it was also
Where was this
malunited.
person first managed?
It was first managed at the traditional bone setter's place. It now presented many years after.
Okay.
You know, about 6-7 years
So
after.
when there is shortness of the bones after fracture and it healed, the chances are, if you have the two bones, instead of two of them aligning correctly,
then they
so
are
one is like
malaligned.
this and it shortens.
Exactly.
So when they come back, you have to
You
break
have to
the
break
bone
a bone
again
and then bring
now
the ends
align
together,
it.
and then we align
So
it. Then
this
we
is
put
to
a nail
stabilize it,
to
right?
stabilize it, and we
Okay.
lock it both proximally and
And-
distally, so that the
okay.
patient could ambulate without any fear of having a refracture.
Great. So how long does this take to heal?
No, it still takes about 3 months for it to heal.
Okay.
The non-bone fracture takes 3 months for it to heal. But what is important is for the patient to be ambulant.
To be able to walk.
By about 4 to 6 weeks,
Mm-hmm.
the fracture is strong enough for the patient to put some weight on it. But with this type of interlocking nail,
Yes.
by about a week or two, if the patient presents freshly, by about a week or two of treating the fracture, patient could actually be ambulant.
Okay, so for a fresh fracture, within
Yes.
2 weeks,
Yes.
it could be fine.
It could be fine,
For
and
ones that
patients could be
has been
ambulating.
mismanaged and come back, it takes
You
a longer
may
time.
want to take a longer time so that your fractures can heal well.
Okay, that's been
Yeah.
very interesting. Thank you
Yeah.
so much for this. We could see the hip.
l-
Is
yeah,
the
that's
hip
the hip.
bone.
So this is the femur
This
bone.
is the femur.
Yeah.
You know, that's from here.
Exactly.
This long bone that gets to the knee.
To the knee, yes.
Okay.
Yes.
That's fine. Thanks.
That's
I'm
the
sure that
next.
our viewers must have found this very interesting. Okay.
This is a complication of a patient that, sought for treatment at the traditional bone setter's place. It was one in which there was a tight band that was applied proximally to the limb. And of course, the patient developed what is called compartment syndrome.
Compartment
Yes,
syndrome.
there was
So the
swelling.
POP that was applied was very
It
tight.
wasn't a POP.
It wasn't even a POP.
Yes, you can see that this does not show that any POP was applied. There was a tight band applied to the fracture around the elbow. And then the blood supply to the forearm was cut off. And of course,
And it's actually looking like a bone injury.
yes, it's not a bones. It's actually the
Compartment
syndrome, and the soft tissue they are getting rotten away.
Okay.
So these are some of
That's,
the
so these are
complications.
potential, and
Yes.
you see a lot of these in the hospitals.
Well, we see quite.
I've been
very-
involved in managing a case of gangrene from the toe to the hips.
Wow.
You know, where we were managing the patient, he had to discharge himself, went to the traditional, and the time he was coming back, the entire leg was rotten
the
and
gangrenous,
had
yes.
to,
Yes,
do
so-
disarticulation at the hip level.
Exactly. So you can see the border where the band was tied. See the
Okay.
healthy tissue
That
up there.
was fine,
then,
and
yes,
this
then the
the
distal
lower
part.
part. So thank you for staying with us. We're still talking with Dr. Adetiloye, who is a consultant orthopedics and trauma surgeon. And I'm sure you enjoyed this session we had to look at the bones. And a key message he has is that it's very best that you go to the hospitals immediately there's a fracture, instead of having to go around the places and coming back to still have the surgery done. He says that there's a lot of competence in using orthodox care or providing care in the hospitals for broken bones or fractures.
Yes.
Thank you very much for being with us. That's the much we can take today on the conversation. We really thank Dr. Adeoye Adetiloye, the coordinator of Federal Capital Territory Emergency Medical Services, who was able to join us and have the conversation. We apologize we were unable to successfully talk to Professor Chinda due to technical hitches on the Skype call we had. We're sure you're going to join us this time next week, but don't forget, our social media handles are very active. Share your opinions, make your comments, make your contributions. We'll keep taking them and it's going to form our subsequent programs. Professor Chinda will be able to, we'll reach out to him and see if we can get him in the studio to still talk about the emergencies that are affecting children in this country. Once again, my name is Dr. Laz Eze, and thank you for watching Talking Health with Dr. Laz. See you next week, and bye for now.